Good evening, everyone. Welcome to another webinar from our patient program series. And I'm Meghna Muskan. I'll be your moderator today for this session. And talking about the webinar today, it's Let's Talk Sex, Sexuality and Intimacy. About this topic. So as humans, we are social creatures. And sex and intimacy is a very integral part of our lives. It is quintessential for our physical and emotional health and well-being. Sex, sexuality, intimacy are just as important for a person with cancer as they are for a person who does not have cancer. In fact, sexuality and intimacy are something that have been shown to help people with cancer deal with it by helping them with dealing with the feelings of distress during their process and the journey of treatment. How a person deals with their sexuality, how a person expresses his or her sexuality is also affected by cancer and its treatment. In reality, a person's sexual organs, sexual drive, desire, the well-being, and even their body image is something that is affected when they're diagnosed with cancer and throughout their journey of cancer treatment. And today we are going to address this very topic. And to join us in this discussion, we have Mrs. Vandana Mahajan. She is a certified palliative care counselor, a cancer coach, and a certified motivational speaker who's been in this field for about 7 long years. She has had a postgraduate diploma in integrative counseling. She is associated with an NGO called Cope with Cancer and works as a volunteer palliative care counselor with the patients of cancer at Tata Memorial Hospital in Mumbai. She also provides telephonic counseling for patients pan-India. Mrs. Vandana herself is a cancer survivor, and she has been conducting motivational talks for the people with cancer throughout India. She provides support and motivation to cancer patients, breast cancer patients in specific, wherein she conducts interactive sessions for them at Tata Memorial Hospital. She is also associated with an NGO called Caregiversaathi and as an ambassador and a mental health counselor. Caregiversaathi is a forum that acknowledges and supports caregivers of patients with chronic illnesses and terminal conditions for the well-being of the caregivers and the people they care for. She identifies herself as a strong advocate for women empowerment, and she conducts several safety training sessions for women across India and in corporate houses. It's so nice to have you, Vandana, here, and I welcome you to the webinar. I would like you to take over now.
Thank you, Meghna, for that very warm welcome. And thank you for Base Care for conducting something which I'm very vocal about and very passionate about. Good evening, viewers. As Meghna said, my name is Vandana, and I identify myself as a cancer crusader. Why a cancer crusader? Because I've been through cancer. And I know what the journey is like. Probably somebody who has experienced cancer is someone who can talk a bit more about it. And in that capacity, I'm here today, and I'm grateful for Base Care for conducting this particular topic, which is rarely spoken about. A cancer patient recovery or violent treatment goes through a lot of changes. And there are different aspects involved. It's not only the treatment. For a total emotional well-being, sexual intimacy, a healthy sexual relationship is also very important. And that's how I'm here today, to talk about something which is a taboo. I have, in my 7 years of interaction, never heard an oncologist address this or a counselor address this. Why I feel very strongly about it? Because I work with patients both from rural and affluent background, and this does make a difference. And that's how I'm here, Meghna, to take you through what I have learned, what I have experienced, and what I have specialized in: sexuality and sexual intimacy and cancer. So with that, I'll begin my talk. We will take it up, women first. The cancer treatment is difficult. It is difficult emotionally. It is difficult physically. It leaves all of us, the ones who've gone through cancer treatment of any kind at any stage, we know how difficult it is for the body and for the mind as well. The sexual organs and the sexual drive also gets deeply impacted by cancer. And what happens is, while we are going through the treatment, not many of us pay heed to it. We don't realize it because the fear of cancer and we are so overwhelmed going through the treatment that this doesn't really come into picture. It is only when we've settled down and when we are looking for a certain normalcy back in our lives that we'll start looking for answers for intimacy. And so let's talk about this, how it impacts a woman. Chemotherapy has very harsh side effects. Radiotherapy, again, is really, somebody who's been through it would know how difficult it is. And surgery. Surgery causes a lot of scarring on the body. So before I talk about each of the treatments individually, I would like to point out what are the factors that affects the sexual drive and the hormones in women. So one is the type of cancer. Second is the type of treatment that is given. Third is the dosage of treatment. That also makes a lot of difference. Yes. Then the fourth is the duration of treatment. Some people go through long-term treatment, some people go through short-term treatment. So the duration of treatment also makes a lot of difference. Then the amount of time that has elapsed since your treatment got over. So for example, if it's been 2 months since your chemotherapy ended, so those 2 months thereafter. And lastly, there are other factors also. It's not essentially always the side effects of a cancer treatment that can affect your libido. Things like diabetes, things like hypertension also affect the sexual drive, both in men and women. And so I actually want to start with something very, very important for a woman, her body image. And the body image, yeah, you were saying something, Meghna?
No, please go on.
Yeah, body image. A woman identify, for me, if I have to see myself, first thing I'll do is I look at my hair. Am I looking okay? That gives me a sense of confidence. Then, when I dress up, I see, am I looking complete? And that is when the breasts come into play. So I'm going to start with hair fall. I have seen hair fall impacts women very deeply. A lot of women close themselves up. When I say close themselves up, they stop socializing, they feel unattractive, they don't want to go out, they think people are going to point fingers at them. So the hair also plays a very, very important role in a woman's body image. For everyone who's tuned in and for everyone who's listening, my simple solution for that: hair does not define you. Hair does not define sexuality. A bald is beautiful. So if you are going through that phase where you've lost hair and you feel uncomfortable with your partner, it's a good idea to just touch your scalp like that, the two of you together. Just touch it, massage it with a little oil, fondle each other. And then you realize it's not hair that matters. It is the emotion that the two of you feel. And hair, as I always say, I tell every one of my patients, in Hindi, we say permanent beej hai. There is a permanent seed. It's going to come back. I've never seen a patient who's never got her hair back. So please do not let the hair define you as much. And for the partners, give confidence to your women. That's so important. Occasionally tell them, bald, you're looking sexy. Yeah. Tell them Okay, I'm going to give you a head massage. Let that warm feeling flow through your body. So hair actually should not be defining your sexuality. Now let's come down to breast. Breast cancer is very prominent. It's very prevalent in India now. I would say all across the world. Earlier they said breast cancer happened to menopausal women. And generally women reconcile. I've seen women, okay, no, that doesn't matter. A loss of a breast really doesn't affect them too much. But when younger women have to undergo a procedure like mastectomy, it is a huge dent to their self-esteem. Women shun themselves. Women look at themselves. I have known women who look at themselves in the mirror and they turn their faces away because they feel incomplete. Yes, breasts do define a woman. It adds that oomph to a woman's body, no doubt. And yes, the sexuality quotient does go up. So, but there are ways to deal with it. Life can be lived without a breast. The ways to deal with it is, number one, get a breast prosthesis. It'll just help you feel, complete. Just help you get back confidence when you're going out. You wear a breast prosthesis. You just feel good about yourself. I don't want to get into the medical reason of why, because that's not, why I'm here. So maybe some other time. But it will just aesthetically make you feel look good. And that apart, when you take off your clothes and when you look at yourself in the mirror, tell yourself you're beautiful. Yeah, touch that scar and tell yourself it doesn't matter. I've made it through such a difficult disease. I'm going through such a difficult disease. This is the least of my worry. Tell your partner. The most important thing in sexual connections and intimacy is communication. So it is also very important for the partner to communicate with the person who's been through through the cancer treatment. If you feel love for each other, then a scar or a loss of breast should not be a deterrent. Stand next to her, run your hand over her scar. Tell her she's beautiful, right? Tell her she still looks complete. Tell her how you would just want. I get goosebumps when I talk this. Tell her how much you love her. Just run your hands all over that area that hurt her so much. Have a hot water bath together. Just let that warm feeling come over you. You'll realize that the loss of a breast, it actually doesn't in any ways affect your hormones. It is only the image that we have in our mind that we feel incomplete. So the onus of it also lies with the partner. It's very important that the partner talks to his woman or her woman and makes her feel good about herself. That is very important. So that is the surgery part of it. Now let's move to the treatment. Chemotherapy. Chemotherapy is harsh. I mean, people who've been through chemotherapy know how tough it is. It can cause so much damage to the body. It's toxic. So without touching on what it does to the other body parts, how it affects the hormones, let's talk about that. It affects, it lowers the estrogen. Estrogen, when the estrogen is lower, a woman is lowered, a woman starts feeling menopausal-like symptoms. So when I talk about menopause is associated with hot flushes, mood swings, and another very pertinent thing to talk about here is vaginal dryness, which a young woman who's been through surgery and chemotherapy will also experience. A woman who goes through a normal biological menopause will experience it when menopause happens. And when vaginal dryness happens, it makes sexual intercourse very difficult. So that is one thing chemotherapy causes. The second is sores in the vagina. Chemotherapy, we know, causes ulcers and it manifests in various ways. So at times, sores come in the vagina that makes, again, penetration very difficult. How we deal with it, I'll address later. I just want to talk about hormone therapy. Hormone, again, lowers the estrogen. So when the estrogen is lower, automatically you start feeling menopausal, and again, the issue of vaginal dryness comes up. Then radiation. Radiation also is tough. Radiation, one is scarring. Scarring, again, I would say the same thing as I spoke about the surgery. Scarring should hardly be, an issue of to actually build up upon for you to not get intimate with your partner. Apply coconut oil, make your woman feel comfortable, massage that area a little, and see how she warms up to you. What it does is radiation to the pelvic. If it is a gynec cancer or maybe a GE cancer, the radiation to the pelvic, say your uterus or your ovaries, the rectum or the intestines, the radiation causes something. One is vaginal dryness. Second is something known as vaginal stenosis. So when we say vaginal stenosis, it means the flexibility of the vagina, the muscles of the vagina shrink. That makes getting intimate very difficult. And radiation also causes itching, it'll cause burning, it'll cause pain. So when all these things happen, it is a natural body's response to not think about sex. The libido, the desire automatically plummets, and no one's to be blamed for that, right? We'll talk about how to deal with these things subsequently. Then surgery can cause pain. If you are, if the cancer is a little advanced, you are on pain meds, you're on opioids, those also affect your libido. All pain meds, opioids can lower your libido. Then anxiety, depression. A lot of us don't talk about it. And I'm also a mental health counselor, and I actually encourage everyone to speak about this. When you have this address, sometimes, psychotic drugs, antidepressants also bring down your sex drive. It's not the cancer, it is the medicines that are causing it. So these are some things, which impacts the physical body of a woman who's going through cancer. Then how we can deal with it. It's very important. For people listening, please know, most of the side effects are reversible. Some may last a longer time, but most of them are reversible. And as a couple, you can work on each other. So that is the most important thing. Communicate, talk to each other, find support groups. In your hospital, if there is a counselor who can help you, help address these issues, is very important. So you have to go to the right person to be able to freely talk about it. I know in India, Meghna, the taboo attached to sex is so big, I would say anywhere in the world, that we don't talk about it in normal circumstances. So during such difficult times, it is important, because like I said, sexual well-being is a part of your emotional well-being. It can help you bond with your partner. It can help strengthen relationship, and it can just give you the confidence that I am okay. I'm okay. I'm loved. I'm wanted, and the will to fight the disease can just come from that bit of that intimacy. And now let's talk about how to deal with these side effects. That is most important. Learn about the medicines from your doctor that can help you deal with it. Learn about the exercises. Pelvic floor exercises is a huge boon. Speak to your doctor after how many days of the surgery, if it is the pelvic area, can you start pelvic floor exercises? They can help tighten the vaginal muscles. They can help in a lot of women go through stress incontinence, or maybe just incontinence because of the surgery. Loss of bladder control happens, and they find women find that this embarrassing, because sometimes you leak urine during the sexual act. So learn about these exercises. There are whatever I am suggesting, first you need to get a clearance from the surgeon and your oncologist. So it is very important. This is addressed in hospitals, which not too many hospitals are addressing this, but it is important. You need clearance from your treating oncologist and the surgeon. For vaginal dryness, vaginal lubricants are available in the market that can be used before, sexual intercourse, that can help the process of sex, make it easy without hurting you. Then there are vaginal moisturizers that are available. Speak to your doctor, speak to a sex therapist who can advise that which ones are okay for you and which ones are not. There are estrogen creams also that are available in the market. So those also, see what estrogen basically does is in a woman, when the estrogen is lower, it causes dryness. So when you apply estrogen cream in the vaginal area, it can automatically, since the estrogen is going inside the body, it will reduce the dryness and it will reduce the itching, it will reduce the burning. So estrogen creams are also available. And for stenosis, which is difficult, when there's radiation, there's shrinkage of muscles, a dilator can really, really help. Not only can it help stretch your muscles, but also reduce the discomfort. So the use of a dilator is a good idea. You really don't need medical supervision for it. It can be purchased and it can be practiced on your own. So, but again, speak to your doctor how soon you can start all these interventions, because if you've been through a surgery of the pelvic area, you may need about 2-3 months before you can actually start incorporating these things. And like I said, again, the pelvic floor muscles. And most important would be communication. For both men and women, and for people of other genders, it is important to feel comfortable with each other. It is important to acknowledge the pain your partner is going through. It is important to communicate with them. It goes both ways. Talk to them about their fears, address their insecurities, give them the confidence. Try and go in for couples therapy, which is again very helpful, because a relation and honestly, you can reclaim your sex life. It is just that you need to overcome that mind block and work your way around. So we'll talk about that later, how we need to work our way around certain things when we go through a cancer treatment. So that is about women and how they get affected, their sexual organs and their libido and their sexual desire gets affected during cancer treatment. So I'm going to take a 2-minute break, Meghna. I need to rest my throat. Apologies for that. I have
no problem. Please.
Yeah.
We're just informing the audience. Vandana gets a little tired after a while. She needs very short breaks in between so she can regain her vocal cords and vocal muscles.
So for the sake of the audience, during my cancer treatment, I suffered some damage to my vocal cords. So I need periodic rests. So that's why if I talk for too long, I have an auto cut in me that says, be quiet now. Okay, now let's talk about men, how sexuality gets affected in men. My main, the first message would again be the same. Communication. Communicate with your men, talk to them, because again, in men, it's a big deal. It's a big deal for a man to be able to indulge into intercourse. Makes him a very big man. It's a huge thing, right? And when there are conditions arise when he may not be able to do so, it can affect his self-esteem. And but please don't fret. There are ways to deal with it, and I'm going to talk you through those. It's very simple. You can reclaim your life back totally. So let's talk about first how it affects the various treatment options that are available. First is, again, surgery. Surgery in men If it is surgery of, say, something like the prostate or the testicles, then it directly affects the man's ability to perform sex. It can cause a situation like ED, which is called erectile dysfunction. Other types of cancers, for example, a leukemia or maybe lung cancer, or those don't directly affect the sexual organs, but just like as in women, they affect the hormones, the testosterone levels, and they deplete the testosterone levels, bringing down the libido. Also, both in men and women, chemotherapy can exhaust you. It can exhaust you to no end. I mean, you feel dead. There are times you have to make an effort to stand up. So tiredness, fatigue, and the stress and the fear combined together, again, both in men and women applies equally, can bring down your desire to have sex. Because if you are constantly tired and you constantly have a fear of what's going to happen, whether I'm going to live, whether I'm going to die, what if it comes back, automatically your desire to indulge in a sexual relationship goes down. So that is one thing. Second would be, when, like I said, when it is about the pelvic area of the man. So the first would be, like I said, the loss of interest in sex. The second would be difficulty in getting an erection, which happens, and men don't want to talk about it. Again, the taboo attached to it is so big that men feel if we talk about it, we become less of a man. But no, you don't. You've been through a very difficult treatment, and these are expected side effects. In majority of the cases, 2 months, 4 months, 6 months, it goes away. The body automatically gets used to it. But in certain cases, there is a permanent or maybe a long-term side effect. This could mean, like I said, difficulty in getting erection. Penetration may be difficult. There could be premature ejaculation. There could be dry orgasm, which means the semen goes back into your bladder, which may cause trouble. There could be hematuria, which means blood coming out from, during the act of sex, and pain during sex. So these are some typical things that a man goes through, in addition to a decreased libido, just because of the fact that they're going through a difficult treatment. Like I said, it is basically the surgery of the prostate, and a penile surgery or a prostate surgery, or the surgery of somewhere that involves the gastrointestinal tract, that can cause your sexual, that can reduce your, or maybe impact your sexual capabilities. Then having a colostomy. I think this would apply to women also. Any kind of colostomy or a urostomy, an ileostomy, any kind of ostomy can also impact you very negatively. It can, seeing a bag attached outside your body where waste material is coming out is not a pleasant sight. That can affect you mentally, and it is normal. I mean, it's nothing unusual that a person goes through. It is heartbreaking, but also remember, it's helped save your life, and it is just, an organ that's supposed to be inside your body is attached outside. Don't feel shy of showing your body to your partner. It is very important, both for men and women. If there is an ostomy bag, it is okay to stand in front of your partner and let the partner see you, accept you, and for you also to accept yourself as somebody who's whole. It's not that your ability to have sex has been taken away from you just because there's an ostomy bag attached to you. It is only because there was no other way out to treat your cancer, and the surgery mandated that a ostomy bag be attached to your body so that you live, you enjoy each other's bodies, you enjoy indulging in sexual intimacy, and you build your bond. Then in prostate treatment, there's something known as brachytherapy. So I don't want to talk about brachytherapy too much, but that can also cause erectile dysfunction. It is very important to talk to the experts when something like this happens. Radiation, it is pretty much similar to what a woman goes through. And again, the major impact on a man is reduced sperm count, though that is not directly related to being sexually intimate. So there is, but definitely there's a reduced sperm count, and also radiation can cause pain, can cause scarring, and in some cases result in ED. And also please remember, a lot of men may not, a lot of human beings, for a lot of all of us, in fact, a lot of times don't pay heed that it's not always the cancer that's causing a decreased or a desire, or just not having any interest in sexual intimacy. It could be a disease like heart disease. It could be something like hypertension. It could be something like diabetes, which both men and women do go through. And that also affects your sexual hormones. And when your hormones are affected, automatically the desire goes down. So it is not that only cancer treatment causes this. Then same thing as women go through opioids, pain relief, medication, that can also cause this. But that is, again, can be taken care of. Lastly would be antidepressants, which, just like they have an effect on women, antidepressants are known to decrease libido. It is a known fact. So when somebody is on antidepressants, they are told that your sex drive is going to decrease. So that happens because of antidepressants. So these are some of the ways in which male body is impacted during sexual organs of a male are impacted during cancer treatment, and the various phases of cancer treatment. But there are ways to deal with it. Speak to your doctor. Most importantly is, see, once, both for men and women, when you go through a treatment, at that moment, nobody wants to talk. Nobody talks about it because it's not really important. But when the treatment is over and you realize you're struggling to find your intimacy back, go speak to your doctor. The doctor doesn't know that you're going through that. Till you voice your concerns, how would the doctor know? Because not all patients go through, lack of sexual intimacy or the desire goes down. Some come back to it, bounce back to it very normally, and some don't. So if you are going through something like this, please speak to your doctor. Erectile dysfunction, I know it is very embarrassing for a man to talk about it, but please remember, to reclaim your erection, you need to talk about it with the doctor. Only then he can prescribe methods. So one of the methods that is advised is the use of medication like Viagra, which can help you retain your erection. Then is, in men also, pelvic floor exercises work miracles. So Kegel exercises, strengthening your muscles around the anus and around your penis, pulling them in and releasing them, and learning exercises, maybe some form of yoga to strengthen your pelvic floor muscles. The options available for men are penile injections are there. There is penile implant is also there. Then there are penile suction pumps, which help a man retain his erection during the act, or maybe help a man indulge into intercourse. And then there is something known as a penile ring, which is all available. If you see, it may not be easily available in a chemist shop. Maybe if you explore, where sex toys are available, there you can get all these. And anonymity can be maintained. You can order them online. Nobody has to know that you're using them. So these are certain things that can actually help build your confidence. When you're able to have an erection and also indulge in the act of sex, it'll just help get your confidence back. And that choice lies with you. no wonder. I can provide you options, your doctor can provide your options, the therapist can provide your options, but to reclaim what you think is lost, the effort has to come from you. Nobody can give you, can force all these things down on you. So it is important, if you miss having sex, please make the effort to reclaim it. So these are some of the things. I also want to talk about penile cancer, because penile cancer is, again, it affects the organ directly. And men are sensitive towards that organ. So let's talk about how penile cancer affects your sexual abilities. So if it is just a very basic surgery like a circumcision, that does not affect your libido, neither does it affect your ability to feel orgasm or or to indulge in intercourse. If it is removal of the head of the penis, you can still get an erection. Maybe you may not feel the pleasure as much, but you can still get an erection and you can easily indulge in the act of sexual intercourse. If it is partial removal of the penis, studies have shown that many men, a majority of them, can get an erection. And don't let the size put you off. It's very important. Don't let the size put you off. You are as normal as any other man. And you can still get an erection and satisfy yourself and satisfy your partner. I don't want to talk about complete penile removal, because that's a different area altogether. Yeah, so that is a long discussion we can have. But yes, this is about the man and his penis. Now let me talk to you about how normal this is and the myths that are associated. I have, I think, touched about every facet, every organ, and how it affects your sexual organs and your ability to have sex. So now I want to talk about the questions that I have faced and how I have answered them, as a counselor, how I address it to my patients. First questions asked are, can I have sex? So I tell them, if before cancer happened, you were having a healthy sexual relationship, there is no reason why you shouldn't now. Please, it can just make you feel so good about yourself. The endorphins and the high that you get can just make you feel, give you an emotional high. So if it was happening earlier, if your relationship with your partner is sound, there is no reason why you should not have it now. Second most important is, a lot of couples don't indulge in the act of sex because they think cancer is contagious. No, cancer is not contagious. I have been through cancer, and there is nowhere in the world that says cancer is contagious. It is a myth. It is a societal mindset which thinks cancer is contagious. Cancer does not pass through bodily fluids. Cancer does not get transferred when you have an open mouth kiss. Cancer, doesn't come out from a woman's vaginal secretions or a man's penile secretions. So cancer is not contagious. Please go ahead, enjoy having a relationship. God's given us this ability, so enjoy it. But there are certain pros and there are certain things that you should be careful about, especially if you're going through cancer treatment. When you're going through cancer treatment, first is the doctor may tell you, again, if you speak to your doctor about it, because there are certain couples who feel the need for intimacy. It just helps them find confidence in themselves that, yes, we are okay. As a couple also, we are okay. Because when a cancer diagnosis is made, a lot goes through a patient's mind and also the family's mind. At that time, sexual intimacy can just help strengthen a relationship. So ask your doctor. The doctor may tell you not to indulge into sex because sometimes chemotherapy causes a drop in the WBC levels. You get prone to infection. So at that time, it's a good idea to abstain from sex. If your platelets fall down, please don't indulge in intercourse, because if the platelet levels are down, then you can bleed out. So then it's not a good idea to go through sexual intercourse. So that is two things these are two situations when you should not be indulging into sexual intercourse. Second is when you're going through chemo. Chemo is eliminated from the body through various ways, through your urine, through your excreta, through saliva, through sweat. So open mouth kissing should definitely be avoided. There should not be open mouth kissing when you're going through chemo. If you really want to get intimate with your partner, the man should definitely use a barrier, a condom, so that the bodily fluids in no way affect your woman. Ensure that a woman who's going through cancer treatment does not get pregnant. It's not a good idea at all. So pregnancy during cancer must be avoided. For people who have ostomy bags, I know it is tough, but you can have sex. There are, a ostomy bag which can be put on your body and put a bandage around it so that it doesn't move. The position has to be different because the normal position may not be comfortable from you. So you could try a sideways position. It is possible. I mean, Kama Sutra gives us a lot of options. So maybe this is one option for you to try something different. So you can have regular sex with an ostomy bag. For your partners, please don't get put off. Your partner's been through a lot. An ostomy bag should not be a reason for you to not build up on your sexual intimacy. So most important is it should remain in place. You could put a bandage around it. That helps two things. It's not visible to your partner, and also it keeps the bag in place. So this is about, ostomy bags. There are different ways to please each other. It needn't be sexual intercourse always. There is oral sex. If you don't feel up to sexual intercourse, there's oral sex, there's masturbation. You can just have a hot water bath together, sit in the tub. I mean, not everybody has a tub, of course. Put some aroma oils in it. Just build up that, environment in your room. Play some romantic music. Wear something sexy. And apply perfume and massage each other gently. Buy oils, massage each other, so that the desire comes back. Desire comes back in many ways. It's not only seeing each other's body, touch each other, fondle each other, make each other feel happy. And you don't have to indulge in the act of sex always. Sometimes just cuddling or maybe just fondling each other can just make you feel so good about yourself and your relationship. And so these are some of the ways that you can reclaim your sex life back. There are certain things which I also want to add here. This was when I was talking about when you're going through the treatment. Post-treatment, I would strongly advocate communication. Please communicate with each other. Talk to each other, join support groups. I know there are not enough support groups in our country. I really can't speak about abroad where these issues are addressed. There is such a horror attached to it when you know that nobody wants to talk about it. But please find like-minded people. When you talk about it, it's like a load that goes off your chest. And when you learn to talk about it, is then you'll be able to address it as well. Till you talk about it, you cannot address it. The partner has to be in tandem with you. Sex is a relationship, a sexual relationship. If it's between two people, it has to be by, the desire has to be in both. So if you want the person going through, your partner who's going through cancer, to feel comfortable, your partner's role plays a huge part. So communicate, make your partner feel comfortable, tell him or her it doesn't matter. If you don't have a breast, it doesn't matter. If you cannot get an erection, it doesn't matter. We will work on each other because we both love each other. We want to be together, and we will find ways to cross the hurdles as they come. So it is very important for this. And remember, sex, what it was before treatment, may not be the same post-treatment, but that's okay. I always feel, as cancer patients and survivors, I always tell myself my life can never be a normal life as compared to my husband's normal. It can never be. My body has gone through a lot, which only another cancer patient can empathize with. So I have created my own normal. I have a normal, but which is my own normal. And I don't compare my normal to anybody else's normal. So please find your own normal. Communication, I come back to communication. Communication is the key. And think out of the box. I've given you a lot of options to think out of the box. You don't have to stick to the conventional ways of having sex. Think out of the box. Maybe it's a good idea at this time to get your hands on the Kama Sutra. 108 different positions in it. So maybe it's a good time to get your hands on it. Remember, sex is a normal desire. It is a biological need. And it is important for your well-being and well-being of your relationship. So talk about it, have it addressed, and reach out for the Kama Sutra. Thank you, everyone. And that's all that I had to say, Meghna.
Thank you so much. That was new, quite new from the topics that we've done so far. And yes, I think you covered a lot of topics. So I'll tell the audience that we had questions collected in advance. We received questions from the audience in advance, and we tried to cover all these questions. She tried to cover all these questions throughout the discussion. Is there any other question that we've left out that we have to discuss?
Yeah, I think there was one on ostomy bag and pregnancy.
Yes.
Yeah. So, see, I am actually not qualified to give you my views on that, but I have seen women get pregnant and have healthy babies with an ostomy bag. So you can have a normal pregnancy with an ostomy bag. For that, you need to consult your gynec or an oncologist. Mm-hmm. Yeah. I think that's all, Meghna. I don't think there's anything else that's left. No. Oh, okay. Again, I think something that I really want to bust all myths about: is there any cancer that's contagious? I think that was one of the questions. Yes. People, there is no cancer that is contagious. I work in a cancer hospital. I work with cancer patients. If any doctor, if cancer was contagious, no doctor would operate. COVID, you can get COVID from one person to the other, but cancer is not a communicable disease. So it's not contagious. I work with patients. I hug them. I hold their hands. I dance with them. And I am a cancer survivor. So please understand that cancer is not contagious at all. Let go of that horrible myth that spoils a lot of lives.
Yes.
I think we've covered everything, Meghna, if I'm correct.
Yes. There's just one.
Yeah.
So we know that there are people who get cancer when they have familial history. they get cancer at a very young age, even before they get married, like in the early 20s. And they have a lot of stress. They're very concerned about, what if I don't find a partner? What if there's a partner, there's nobody who wants to get married to me because I have a risk of cancer, or because I already have cancer. What do you think they should do at this point?
Meghna, that is something me and my very dear friend Mehul, we are working on that. Unfortunately, there is a problem if you're diagnosed with cancer and you're not married. In India, it is a challenge. But I have spoken about how cancer affects the sexuality. So marriage or no marriage, your sexual organs would still be affected the way it is affected for a married man. And if you are unmarried and you do get married, you can have a very happy married life. Maybe it's a good idea to talk about ova preservation or sperm preservation.
Okay.
That is my advice to young people who are unmarried, because chemotherapy does affect your ability to, in terms of ova and sperm. Otherwise, please go ahead, married, and have babies and have sex and enjoy life.
Yes. Also, one thing would be, what are the support groups? Like, is there, like you said, there aren't many. Would you like to tell our audience if there are any that you're associated with, or there are any support groups that they can look forward to or find out about, that they can reach out to?
I wish, Meghna, I had an answer for that. Till date, I think I'm the only one who's openly spoken about this. And I'll be happy to address questions. I'm available on social media. If you write Vandana Mahajan, maybe you can reach out to me. There are no support groups where I have ever heard anybody talk about their sexual problems. And I wish we can have one where such openness is there. That openness can come only if you choose to. I chose to speak about it, because I think it's an integral part of life. So the others have to be comfortable with their bodies, with their sexual desires, and the idea of sex. And that's how, we can have a conversation about this in support groups.
True. I think we've covered all the topics as such.
Yes, I think so. I don't think of anything that we may have left out, but if there are any, please reach out to me if there's somebody. I think we've covered everything practically from hair down to your toe, apply nail polish, massage, get into pedicures and manicures. So we've addressed everything, Meghna.
It's wonderful. Okay. So yeah, I think the end note would be to have patience, understanding, and compatibility. The key word is communicate. Communicate. That's all can help you. That's all can get you through everything, and through anything for that matter. And that would go for people with cancer and without.
Absolutely.
A lot more so for people with cancer.
Yes. And also it is very important for, I think, in any relationship, any sex relationship, to be able to talk about sex between the partners. And that's from where the comfort of talking about it through any situation will come in.
Yes.
The acceptance of sex and the desire should be considered as a basic need of the body, and there's nothing to be ashamed of. So when that acceptance comes, I think talking about it would not be such a taboo.
Yes, absolutely. So I think we are done with the session. I take great pleasure in knowing that we were able to talk about this topic, address this topic, and I think we have a note. Okay, somebody says that they're very grateful that we had this talk. Again, like we've said, it's not easy to address these topics. I'm glad that we did this. I'm glad 4Base Care allowed us to have this discussion so we can reach out to as many people as possible to bust out all the myths that they have about cancer treatment and sex. And yeah, thank you so much for your time on a weekend. I thank the audience for taking their time out on the weekend for this discussion and to make this a success. Thank you so much, Vandana, again. And Good
Thank
evening,
you.
everyone.
Yeah, thank you, Meghna and for Base Care for conducting something which I'm really vocal about. The more we talk about, the more lives, the more relationships we'll be able to save. And I think together, if we join hands, we can actually, support and help a lot of families going through cancer because it's tough.
It is tough, indeed.
Yeah, it is tough. Thank you for having me here. It's been a pleasure.
Thank you so much. Thank
Thanks.
you, everyone. Have a great weekend ahead.